Hi guys, good morning. Welcome sa live. Yes, nandito tayo ngayon para i-discuss ang concept regarding sa diabetes mellitus. Okay, in particularly diabetes mellitus type 2. Okay, una, well, let's define first kung ano ba yung diabetes mellitus. Okay? Well, diabetes mellitus para maintindihan natin kung ano yung meaning nito. Ang diabetes mellitus po, this is a condition, okay, a medical condition in which the sugar or glucose level build up in your bloodstream. So, ibig sabihin, ito yung kondisyon ng katawan na kung saan ang ating sugar or yung glucose, yung pinaka-simplest form ng sugar, okay, ay nagbi-build up ng napakataas sa ating bloodstream or sa ating dugo. There's not enough insulin to move the sugar into your cells, which are where the sugar is used for energy. Ideally po kasi yung sugar is ginagamit siya for a source of energy, yung sugar. So this time, pag nagkaroon ng diabetes ang isang pasyente, kulang ng insulin para ma-deliver yung sugar sa ating parte ng katawan or sa mga cells ng ating katawan. Okay? This cause your body to rely on alternative energy source in your tissue, muscles, and organ. This is a chain reaction that can cause a variety of symptoms. Type 2 diabetes can develop slowly. The symptoms may mild and easy to dismiss at first. So yung early symptoms ng diabetes mellitus, ito yung constant hunger, a lack of energy, fatigue, weight loss, excessive thirst, frequent urination, dry mouth, itchy skin, blurry vision. And as a disease process, these symptoms becomes more severe and potentially dangerous in your blood sugar level have been high for a long time. The symptoms can include yeast infections, slow healing cuts of sores, dark patches of your skin, foot pain, feeling of numbness in your extremities, or neuropathy. Neuropathy, that means nagiging manhid ang iyong mga kamay at saka paa. Okay? So if you have two or more of these symptoms, you should see a doctor. Without treatment, diabetes can become life-threatening. Diabetes has a powerful effect on your heart. Women with diabetes are as twice as likely to have another heart attack after the first one. They are quadruple the risk of heart failure when compared to the women without diabetes mellitus. Diabetes can also lead to complications during pregnancy. Okay, so una, ano ba yung diabetes mellitus? Okay, or yung cause ng diabetes mellitus? Insulin is naturally occurring hormone. Your pancreas produces it and releases it when you eat, and insulin helps transport sugar from your bloodstream to cells through your body when it used for energy. If you have type 2 diabetes, your body becomes resistant to insulin. Your body is no longer using a hormone efficiently. This forces your pancreas to work harder to make more insulin. Over time, this can damage cells in your pancreas. Eventually, your pancreas may not be able to produce any insulin. If you don't produce enough insulin, or if your body doesn't use it efficient, glucose builds up in your bloodstream. These levels your body cells starve for energy. Okay? Doctors don't exactly what triggers the series of events. It may have to do with cell dysfunction in pancreas or cell sig- signaling and regulations. In some people, the liver produces too much glucose. There may be generic predisposition to develop type 2 diabetes. There's also a generic predisposition to obesity, which increase the risk of insulin resistance and diabetes. This also be an environmental trigger, most likely the common combinations of factors that increase The type 2 diabetes, okay, is ongoing. Medications for type 2 diabetes. What are the medications for type 2 diabetes? Okay, it's metformin, which can lower your blood sugar level and improves how your body responds to insulin. Okay, and the better way is that you need to look for attending physician to attend to this concern. In particularly, you need to visit the endocrinologist. Okay, so endocrinologist, because they are responsible for patients having diabetes mellitus. So, anyways, what were the risk factors for type 2 diabetes, or shall I say rather, a tips how to prevent type 2 diabetes? You can always prevent type 2 diabetes. There's nothing you can do about your genetics, ethnicity, or age. If you have a pre-diabetes or other diabetes risk factor, or even if you don't have, few lifestyle tweaks can help delay or even prevent the onset of type 2 diabetes mellitus. These changes in diet, exercise, weight management work together to help your blood sugar level within the ideal range of all day long. What are the suggested diets for diabetes mellitus? Well, your diet should be high in nutrient-rich carbohydrates and fiber. You also need heart-healthy omega-3 fatty acids from certain kind of fish, or monosaturated and polyunsaturated fats. Dairy products should be low in fat. It's not only what you eat, but also how much you eat that matters. Okay, you should be careful about portion sizes and try to eat meals at about the same time every day. Well, what is the advantage of having an exercise? An exercise for type 2 diabetes is associated with inactivity. Getting 30 minutes of aerobic exercise every day can improve your overall health. Okay? So, thank you for watching my YouTube channel. Maraming maraming salamat po, and please paki-subscribe and huwag kalimutan i-click yung notification bell para updated kayo sa mga susunod kong mga vlogs. Thank you po. Maraming maraming salamat sa patuloy na pagsusupport sa aking vlog. God bless.